Blood pressure assessment. Before the actual assessment, I will briefly go over the necessary equipment. An assessment requires an appropriate arm cuff, manometer, and a stethoscope. The patient should relax for at least 5 minutes and refrain from caffeine or smoking 30 minutes prior. The patient should have their feet completely flat on the floor, arms elevated at heart level, and have their back supported. Identify the artery mark on the cuff and place it over the brachial artery. Firmly wrap the cuff around the patient's arm approximately around heart level. It is important that the correct arm cuff size is utilized for accurate measurements. The cuff should encircle at least 80% of the upper arm. Then place the manometer in a visible place prior to the measurement. Make sure the ear prongs on the stethoscope are facing forward. Make sure that the valve is completely sealed by twisting the bulb all the way to the right, then gently tap the chest piece to ensure that it is functioning properly. Then place the stethoscope chest piece below the antecubital space over the brachial artery. Next, inflate the cuff to 200 millimeters of mercury, then release pressure by slowly twisting the valve to the left at a rate of 2 to 5 millimeters of mercury per second. While releasing pressure, you should listen for Korotkoff sounds, which consist of 5 phases. The first clear tapping sound will signify the systolic pressure reading. Continue to listen as the sounds fade. The fifth sound should be almost silent, which indicates the diastolic pressure reading. The following is a chart for classifying blood pressure readings. It is important to remember that at least 2 measurements be taken per visit, and the patient be given a 3 to 5 minute time frame in between readings for accurate measurements to be taken.